Okay, so this is me, and I'm sure all of us are part of this as well. We work with our brains and we work with our heart, and we have many, many, many roles. You're listening, you are making rules, you're making regulations, you're making decisions at work. And then when you go home, you're handling the home environment, whether it's kids or parents. They are ill, you need to bring them for their medical checkups, and then you got to sort the family operations, meaning, food on the table, and if the pipe bursts, you have to go figure what's happening, right? So my life is not different from anybody's lives. We have many, many challenges, and it's very important to stay kind of steady in order to do that. Just a little bit about what exactly do I see in the work environment. Next slide, please. If not, it's okay. So, this was just, the slides will be out and you can copy this and put it onto YouTube and see. It's basically the ED environment. In any country in the ED, it's a lot of chaos, and often it's organized chaos. And I'm sure Dr. Pua, the next speaker, is going to share more about it. And what happens is that there's this ambulance siren that keeps coming on, and then you have acutely ill patients to minor patients, right? And every moment or every minute, there's something that's always changing, right? And when you have a lot of patients, right, either waiting, already seen, and if you have a bed situation, so your entire environment is going to be cluttered with a lot of patients and overcrowding. And when you have traumas happening, right, or an acute cardiac myocardial infarction or heart attack that's happening, you have a lot of other teams and come down from inpatient, right, essentially to assist you and activate and bring them to the operating theater or do interventions together with the ED physicians, right? So, and nurses are also around helping us, right? So there's a lot of activity that's happening, and there's a lot of external stimuli that happens, right? And there's a lot of noise that happens. And all of these actually trigger our own emotions and our anxiety level, right? And that adds on to stress. I put stress in inverted commas because all of this is actually part of, for me, a daily event, right? And similarly, even in everybody's job setting, you have your usual stress, or actually your daily events that happen in your work environment. And we wrongly label it as stress because, then that gives it a negative connotation that it is stress. But actually, it's just any event that just happens as your daily activity, and that's our work and our life, right? And so it's how to bring that and incorporate into you and try to maintain that kind of a balance in order to kind of handle it without being too heavily emotionally charged, right? Because when you're emotionally charged, we end up, not seeing things from a bigger point or bigger perspective, right? And then we end up getting a little bit more blinded, right? And then that has impact on the decisions that we make. Very specific to the ED physician is that when we get very agitated or very stressed by the events, and you start thinking that, I need to rest, I need to um, I'm really angry. Why are they doing this? Or why is this patient coming? That sort of thoughts. The mind starts playing games, right? And when that happens, it's very difficult to stand back and see things as it is, being present in the current moment, right? And making important decisions in a calm manner, right? So it's now going on to how do I not call this stress, but really go on to looking at things from a different perspective. It is what it is, right? And how do I develop a sort of a resilience in order to take it as it comes without living in the past and without predicting what's going to be, but just being the present moment and focusing a task after a task in an equanimous manner. Next slide, please.
Annitha, sorry
Yes.
to interrupt you, but
Yes.
I could share screen with the video. You would like us to do that?
Yeah, that would be, yeah. You could even do it
Yeah,
at the
even
end.
if
So,
you
yeah. Yeah,
even
it
if
can even be done
you
at the end. Yeah.
stop share. Okay, sure. You are displaying a lot of equanimity and calm.
Yeah. So while she prepares, so I'll go in. So being in our lives,
Um,
right? We all have many roles, family, work, community, and work within community and all. And so we have multiple tasks. And this we call it as our duty, right? Like if it's our child, we want to do something for the child. If it's our spouse, we want to do something because we think it's our duty. And that's not wrong. But these are all actually multiple tasks. And with that, we incite multiple expectations in our own mindset. This is the way it should be done. It's below my standard. This is, so we set certain bars for ourselves subconsciously, right? And that adds on to this perception of stress when it doesn't appear or go in a manner that you want it to be seen, right? And that's something that you need to address, right? All of these, many roles and multiple tasks, what happens is that it creates a biological response in our body 24/7. Happens to anyone. The only time we don't have any response is when we pass off, right? Even as a child, when you're born, right, there are biological responses that happens in the body. And why? Because the mind is active all the time, right? And when the mind is active, a lot of thoughts are running in the mind. And and at the same time, right, stress hormones also build up within us. The stress hormones are normal. It's just the body's response, right, in order to create a fight, flight, or fright situation. But because of the multiple tasks that we do, our own perceptions of how we want it done, right, there's this constant level of stress hormones that continue to circulate within our body system. And that kind of trains the mind to react in a very reactive manner. And so these stress hormones, sorry, right? And so these stress hormones, what happens is that they translate physiologically in the following manner. Our breathing, right? You start breathing a little bit more faster in terms of our heart rate, goes a little bit faster and you don't even realize it. Blood pressures, if you measure it, will go high, right? At the same time, the mind being active in the stress hormones, it translates psychologically or rather emotionally into the following emotions, right? Anxiety, fear, anger, depression, impatience, paranoia, and all of it, we put it as stress, right? But what happens is that this physiological element and the psychological element, right, they translate to how we communicate, interact with everybody else, right? Let's switch it over. When the task is completed, how do we feel? We feel relieved, we feel at peace, we feel happy, we have accomplished, right? We feel very accomplished. And so this is the state of mind that we want to move towards, and that helps us to reach a certain degree of calmness. Next slide, please. And so our goal really, this calmness that we're talking about, is really maintaining equanimity, has a state of calmness. The equanimity is a default balanced emotional state. That's important to develop gradually because that translates to calmness. And why is it important? Because it helps us to stay calm and to be in the best element to embrace life and its challenges. This is it. This is our life. It is what it is. How we make out of it is the key thing. And we can choose to enjoy and stay equanimous and try and absorb whatever that comes through life's challenges and grow from it, right? Or we can choose to be negative or be upset or depressed, and that just pulls you down and does not allow growth in a constructive manner to happen, right? And so this state of equanimity is extremely important, and it helps us to think clearly and make decisions calmly, after you've put in much thought, rather than run into the emotion, and that kind of blocks the certain parts of the brain that creates this fight, flight, and fright experience. But what is the value of working towards equanimity, which helps us to remain calm, right? Is really the fact that it helps us to to benefit psychologically and physiologically because your stress hormone response reduces. When someone has got high stress hormones, right, and you're consistently running at a high hyper state or hyper arousal state, what happens is that we always would end up, having this constant heart rate being very fast, going to cause us to always breathe very fast, and some of us may end up with hyperventilation attacks, right? And it also always causes our blood pressures to go very high, right? And this constant state eventually can actually damage our own, it can actually damage our own organs itself, right? And so it's very important to try and work towards reaching equanimity. But how do we actually do this, right? A previous slide, please. Yeah. So how do we actually do this? I felt in my experience, getting to know exactly what were the mindfulness practices and then making the effort to actively practice it. I thought that, okay, I don't need the formal, I'll just stick to the informal practices, right? You know, as I'm walking, I'm doing walking mindfulness practice, or when I'm eating. But that's not enough. When you sit and do a formal practice, it helps us to sit down and just watch the mind. It's beautiful to watch the mind, right? And as you watch the mind, when you're in different states of emotion, whether you're happy, whether you're at peace, whether you're angry, or whether you're anxious, especially when you're anxious, right? Or whether when you are sad, right? Or your mood is down, or you're disappointed with yourself, right? It's interesting to watch the way the mind floats from one thought to the other. And therefore, the formal practice is valuable because it gives a lot more insight, right? And this helps you to train the neuroplasticity in the brain as well, right? Next slide, please. And so paying attention to our body and our mind is extremely important. And what that means is really to create this degree of equanimity is really creating self-awareness. We have to look inwards and create this self-awareness and recognize what state of mind am I in at this present moment. And so we need to gradually use these practices to recognize what is my own internal physiological changes that's happening right now, right? And what are the psychological changes that's happening right now, and what sort of emotions is running through in my mind at this present moment, right? In whatever circumstances we are in. And bringing our attention to the physiological changes is, how am I breathing? Oh, I'm breathing a little bit fast. Why am I breathing so fast? Step back, right? And see what is the reason for that, right? Oh, my heart rate seems to be running a little bit faster than usual. Why? May not necessarily be the 3 cups of coffee that you had, right? Well, I'm feeling a bit discomfort. I'm feeling a bit woozy. I'm feeling a little bit nervous. It could be a lecture that's coming up, or an exam that's coming up, and then I have a little bit of giddiness. I'm now having a tummy upset. So these are all physiological changes. So bringing your attention to this will help you to uncover or discover what is the emotional change that I'm going through at that point in time. Why is this important? Is because you want to identify the mind traps. Why? Because mind traps are the ones that the mind uses in order to add on or worsen the emotion that you're having, right? And that kind of then worsens the physiological changes that happen, right? We'll talk about mind traps in a short while. And so bringing our attention to the following, the physical changes that's happening inside me right now, and the emotion that I'm feeling right now, right? And these two key things we would identify when you start doing short practices, right? Now, it's not easy to do it at first, because that's what I felt. Because as ED physicians, I'm sure Dr. Paul would, is we have flights of ideas. Our attention span can be quite short because, the way we work is such that, we run from one thing to another thing every minute, right? And so we naturally bring this to our home too, right? And we start having to delegate things to other people without much thought in that sense, right? And so I found that it was a little bit difficult at first to kind of sit down and just concentrate on breathing, because each time I sat down, I would fall asleep, right? Because the only time I don't fall asleep is when I'm standing and walking around and seeing patients, right? So, so it was a little bit difficult, but with practice, 5 minutes and 5 minutes, and bringing attention to the breath, bringing or watching the mind, and gradually, increasing it to 10 minutes and then 15 minutes, right? That sort of helped. It is doable, right? But the key thing is really we want to bring our attention to physiological changes that's happening within me, right? And the psychological changes that I'm feeling right now. I will keep reiterating it because I felt this was a very basic thing to start that helped me, right? And it may be useful for those who are in the beginning stages of mindfulness practice, right? And sometimes it's very difficult for some of us to sit down, and I tend to also try and address the emotion rationally. So I would use the sentence like, I am now feeling angry. And I'm wondering, why am I feeling so angry? What is making me feel so angry? What was the events that happened that's making me angry? Right. And so then you direct the mind to start thinking of the events. And then it helps you to rationalize and step back and see what were the events, who were the people involved, and how should I have, reacted in this manner and why. Okay. So that helps you to rationalize when you articulate, the emotion that you're feeling. This is especially when it's difficult to sit and do the breathing exercises for some of us, right? When we are beginning to start. There are also other mindfulness practices that may help, right? Breathing, body scan meditation, which some of you may already know, right? And then the stop practice, which a colleague of mine has shared with me previously, right? And all of these will help you to snap out from the emotion that is, paralyzing us, right? Because when that happens, it focuses us to move into a mind trap and perpetuates the emotion. Next slide, please. Right. So this is just one example of practice, which is the stop practice. So, if you notice physiologically that, I don't feel well and I don't know why, I just feel like my brain's in in pieces. I can't seem to concentrate for whatever reason. I did have a good night's sleep. I don't know why. Then take a moment for yourself. This is about you, right? Stop what you're doing, step back. We think that, by stepping back from work or from the environment that you're in, it will take me away from all of the work that needs to be done. But no, the 5 minute or even the 2 minute step out, it's not very long, and you may come back rejuvenated. So stop what you're doing at a point in time, put whatever things that are, or you're feeling distracted in the environment, and you step out or move to a quiet spot or go for a walk outside. Take a few deep breaths, sometimes listening to nature or the birds chirping, right? Or just inhaling the fresh air will help us, right, to start controlling our breath and to slow down. Sometimes you'll notice that, we may be just breathing very fast. And that's the first time you might even pick up that, why am I breathing so fast? And then observe your experience as it is. Monitor, or rather, watch what's running through the mind, right? And watch what are the emotions that are running through. Watch what your body is feeling, what your posture is. Because sometimes when you're stressed, a lot of us actually have straightened backs or hunched up backs, right? And we are tight in the neck muscles and the back, right? And these are actually, because you are in this fight, flight, fright situation or posture, and that may not be relaxing you. So when you breathe and you start noticing it, then you ask yourself, why am I feeling this way? And then, you slowly bring in your breath, right? And rationalize. And then after that, you can proceed to go back to whatever you are doing, right? Or you feel that you need to take time out and have a drink, and you can do that. So you could do this, right? I've tried doing this many times, especially at work, because sometimes it's quite difficult, right? And when we get dragged into our own emotions and the rush of the environment outside and absorb whatever is happening in the busy ED environment, or in the busy home, when suddenly things are all over the place, right? This has kind of helped me to just step back, rationalize, get my position back, get back to grounding again onto the ground, right? And then start again. And so when that happens, right, you naturally go into, as you keep doing this frequently and exercising, it becomes a very strong muscle. The brain becomes a strong muscle. And what I noticed is that, gradually, the calmness and equanimity just set in. gradually. It's not something that happens overnight, but tend to step back and you see what's happening, and we don't react so much emotionally, and the decisions that we make, right, it's a little bit more sound, right? Or more importantly is that your relationship with the people or the comments that you make, right, or when you communicate, it makes it a lot more easier, and the tone is also, very equanimous as well, right? Next slide, please. Right. So now we'll just go about mind traps. It's a very important concept. It was a realization for me because when I was practicing, and slowly when I got the breath in control and I started watching the minds and started noticing that the emotions kind of perpetuated into this negative spiral when it started talking negatively, right? So then you realize that this is a mind trap. So, sometimes there's 7 mind traps, right? And one is emphasizing the negative. So the mind's kind of self-talks, and it says, no, this should not be the way it should have been done. Why are all these people doing it this way? That's wrong. This is not the way the other person has to be behaved. It's very natural. It's harder to remain positive, right? It's easier to play the blame game or find the faults. In a piece of blank paper, your attention will always go into the black dot or the blue color handwriting. We never look at the white, right? Similarly, to a wine glass that's half filled, we only look at the wine glass that's half filled, but we don't think about, we don't, we only look at it, oh, it's half empty, right? Or 3/4 empty. And what the mind says, I need more wine, why not? But we forget to enjoy that quarter amount of wine that's still there, or quarter amount of drink that's still there, and savor it and enjoy it, right? So that's just a natural tendency of the mind to identify or see what is not normal, what is abnormal, and so it tends to emphasize. So that's how it is with our thoughts. The next thing is negative self-talk. That's also another mind trap. Negative self-talk is, why do you need to do it? That you're always doing this, you're always a failure. You see, many years ago also never passed the PSLE, so that sort of, so again you're going to fail. So these are negative self-talk. So that's another mind trap. Then should is, you feel righteous that this is not the way, this should be done this way, that should be done this way. This is how you should cut your vegetables. It has to be 2 centimeters and 4 centimeters wide. If not, it will not look nice. So there's a lot of shoulds, and that's also another mind trap, and that adds on to anxiety, not just to yourself, but if you tend to exhibit this, it tends to stress the family around you, and they go into jitters. Now, catastrophizing. Now, this is very much for the emergency physician. For example, I'll tell you. For example, we have a 40-year-old patient who comes in with chest pain, it's localized, and we say, oh, it's radiating a little bit to the back. And with the worst things, we are trained to think of what are the worst possible scenarios and diagnosis, right? And massively investigate for that when, and then, say that, okay, it's fine, nothing. So that catastrophizing sort of behavior trait naturally gets, kind of coded into our DNA. And so, for example, you even like when you're walking in the street, you will be thinking about, what if the tree falls? It's raining and the lightning, the tree is going to fall. And then when the tree falls, somebody's going to get hit. And then they need to activate the SCDF ambulance. That's a lot of work, right? So the mind catastrophizes. Small thing gets blown out too big. Or imagine, so that's living in the future or preempting or predicting, but that may not be what would happen, right? Mind reading is, for example, I didn't like that patient. I think he's going to complain about me. My superior just scolded me. I think my superior is going to scold me because I came late today. Right? I think he's going to give me, a B minus for my appraisal. There goes my performance bonus, right? So there's this degree of paranoia that sets in. So that's also a mind trap, right? But that may not be what's happening. Next is the eternal expert, right? Where they are the ones who are always telling that, I am the best. I am the only one who can be correct. Nobody else can be correct here, right? And what I say goes, everybody follow rules, right? So that's also my trap, right? And finally, blaming. Blaming is very common, and we tend to do that more to ourselves, more rather than the others. Of course, there's other others who want to say, will say, for example, like, I'll always say, my husband always, make sure, that he dirties the table, doesn't clean up after him, and things like that, right? So we're always blaming others, right? So these are some of the mind traps that could be actually happening, right? And we don't even realize it. And that kind of sense of this spiral of emotions, right? And that adds on to more anxiety, more stress, and more anger. And then this translates actually to, you know, how we communicate or bond with anyone, and that just adds on. And so life already has got a lot of challenges, but we create a lot of drama with these mind traps and the emotions, right? And so it's difficult to be calm, and so it's important to bring us back to trying to work towards equanimity and recognizing what are these mind traps. And that's the only way to do it, is really practicing mindfulness in a daily practice, right? In a manner that suits you, to try and watch the mind and see, hey, why is the mind talking like this? What's making the mind talk like this? Or what's making the mind think like this? And it's quite interesting to watch the mind and watch it like a third person. It's quite interesting. And when you give the attention to the mind in a manner, it will be quite an interesting drama that you begin to watch, right? Next slide, please. So this is just a slide of the 7 mind traps. Next, please. Yeah. Right. So challenging emotions, these are the ones that we always have. But anger, fear, depression, anxiety, they can be positive and they can be negative. And so it's always good to reach the degree of state of equanimity. Your anger, when it converts to constructive energy, that's good, right? But the anger that causes a lot of destruction, that's negative. Now, the fear, it's good to have fear, right? I mean, if you watch a tiger, right, that's trying to attack you or trying to snatch your kid away, that fear shouldn't paralyze, but the fear should give you the energy to create anger, right? And actually run away, which is the right thing to do, right? And not stay and fight, right? So some fears are good, but some fears where, I am afraid to take the bus in case I fall. And that fear is paranoia, and that limits how much you can do and affects the quality of our life. That's not good, right? And so, these emotions needs to be balanced, and these emotions should be directed in a manner that is constructive for us to go about the challenges in our life, and not absorb it too much that it paralyzes from what we can do, right? The only way to move towards it is really becoming self-aware, right? So recognizing our own state of mind at the present moment, and recognizing our own internal physiological changes and psychological changes when you run through emotions. So how do I do that? So asking myself, what am I feeling at the present moment? Why am I feeling as such? So you bring in curiosity and a beginner's mind. Then rationalizing the feeling, be aware of the mind trap. So I'm practicing non-judging. I'm just looking at the situation as a third person, right? Watching my mind and seeing how it's moving. And that's rationalizing the feeling. And then telling yourself, it's okay to feel this way. I'm feeling angry. I'm feeling agitated. I'm feeling anxious, right? But telling yourself in your mind, it's okay to feel this way, I need my time, that's actually bringing in kindness, acceptance, and patience with your own self to watch the emotion and the sense that you're feeling, because that will help you to rationalize and recognize the mind trap. And once you're set in that feeling of dis-ease, right, then you will feel this sense of, I'm ready to move on. And that's also kindness, acceptance, and letting go of that emotion that you're feeling. It's not letting go of that situation, but you're letting go of the emotion that's paralyzing you for that moment, right? And all of this then brings you to a stage of equanimity, is wisdom, And that will make you have gratitude to the experience that you're feeling. And non-striving. Non-striving means that it kind of brings you to a state where you know when to do what, when not to do, right? And your emotions don't push you to make decisions or do things in order to satisfy our emotions, right? So that's the state of equanimity that one will gradually reach when you go through these steps methodically. Next, please. Right. So these are the attitudinal foundations of mindfulness, which is shared and described greatly by Dr. Joe Kabat-Zinn, right, who started the mindfulness stress course, right, many years ago. And if you have time, right, do check on the YouTube videos where he describes these and brings us through different practices. I used to look at this to try and go deeper into understanding what mindfulness was and to practice it, to try and work towards, rationalizing my thoughts, my emotions, and working towards reaching a degree of equanimity and calmness. Next, please. Previous slide, please. Previous slide. Okay, sorry, next one. And so at the end of this session that I've shared, I think it's really important, my own feel, is really making the effort to do our formal practices, right? And what happens in formal practice is you're not allowing your impulses to translate into actions. So you're creating this safe space around you, right? It's a safe space that does not allow the reaction to move, right? But it just allows you to sit and watch the thoughts to help you to move towards rationalizing and seeing things from a bigger perspective without the emotion. So when that happens, the mind is creative, right? And you have new insights to the experience that is happening. And as we continue to do this formal practice, what happens is that space becomes stronger and stronger and builds this by default sort of resilience, right? And that translates eventually to equanimity in every other situations, just like that, right? You don't need to work towards telling yourself, I need to be calm, I need to be calm, I really need to be calm, right? So it doesn't have to, it just naturally goes into that default equanimous state of mind. Next, please. Informal practice is something that you do, right? Which can be any time of the day, right? When you can find peace and quiet. Let's say you love drawing or you love painting, even that 10 or 15 minutes, that's also mindfulness practice. Putting the effort or thinking in the present moment. Let's say when you're showering, why do you feel relaxed after a shower, right? It's because you're concentrating in the water. We feel the sense of warm water rushing through and relaxing our muscles, right? And your mind is actually in the present mind, right? And that's also a mindful moment. Similarly, taking some time out to eat, slowly and chewing and enjoying the food, that's also mindful practice. But what it helps is that informal practice helps to kind of moderate our breathing to the present moment and experiencing the sense of peace, right, and calmness in that moment, right? And as you keep doing this each time, right, it helps to build a little bit more resilience and a default mood of working towards reaching equanimity. So both formal and informal practice are actually very useful to help us to move towards trying to work towards balance, emotion, and building resilience. Next slide, please. So in the end, what is mindfulness? It is basically our human ability to be fully present, aware of where we are and what we are doing, and not to be overly reactive or overwhelmed by what's going on around us. Because when that happens, right, we are constantly in this stress hormone state, right? And that just takes a control of us and makes us react or communicate in a manner that may just not help us later on, right? And so it's really to bring us back to this state of equanimity and have a balanced emotion, right? So that, we can have rationalized and feel at peace as you go about the daily challenges in life. Next slide, please. And so the final point I'd like to make is really self-care. We do have to realize our worth and our value. And that starts with us showing loving kindness and showing compassion to us first. When you start doing that, the mind starts, feeling that, it's important, right? And we start respecting ourselves and show dignity to ourselves and the roles that we play. We are not replaceable, and we have our roles, the work that we do, and our responsibilities, which we take it seriously upon us, to fulfill. And so it's really key to always show self-care, right? So look to nature and its quiet strength, and that helps build resilience within us to go about our duty. And as we reach that state, then we will see how beautiful life is and show gratitude and awe. And we bring in this beginner's mind and curiosity into our everyday. And that brings you to this state of equanimity, right? It's not a blunted effect because you don't suppress, but you are building this degree of resilience when you show self-care, loving kindness, and compassion to your own self. When you do that, right, uh, the mind and the body realizes that, I'm respecting myself. I am an important person. My role is important, right? When you do that, the energy that comes out of it is a lot more constructive and at peace. Next slide, please. And so just want to summarize, maintaining calm amidst the storms is realizing our emotions and articulating the emotion, like I am now feeling this way, right? Recognizing the mind traps, and then using the mindfulness attitudinal foundations to help snap out from the emotional state that we are in, right? And what we are working towards is really to develop equanimity and resilience internally. So it's really our own internal resilience that we're trying to build and the calmness, right? It's not working to give it to somebody else, right? So it's about us and our own self-awareness. Next slide, please. And one last point is, working towards trying to see humor in whatever that we do when we're in a storm, right? There'll always be solutions. If one thing doesn't turn, there'll always be another, right? And another door that opens or window that opens, and rather than get stuck in the rut of that emotion of the event, you step out and you see the other side of things, the light of things, and that takes training, right? And when that happens, right, life gets a lot more tolerable. Challenges are not challenges as what we see, and every challenge that comes, really take it in the real meaning. It is a challenge, not in a negative sense, and let me resolve this challenge. Let me see what else can I do differently in this challenge. And that gives you a lot more energy, right? And joy to try and produce and do things differently and create and innovate, right? And that's what the human potential is about, right? With that, I would thank everyone for this opportunity, right? And I do hope that, I made some sense in what I shared, right? And do practice, and that helps. It has done a lot for me because it wasn't so easy in the initial phases, right? But it's helped me very much to see things in different perspective and try to innovate different things, right? In that sense. Thank you, everyone.